My name is Bamidele Osamika. I'm the Regional Climate Collaborative Manager here at Green Umbrella. Green Umbrella is a regional climate collaborative in Greater Cincinnati. We have been serving as a backbone for environmental and sustainability work for the past 25 years. We have connected hundreds of members, businesses, non-profit, academic institutions, as well as passionate individuals to environmental efforts here in Greater Cincinnati. So through our collective impact approach, we have also been tackling the most complex and pressing environmental challenges. This webinar is titled Climate Change, Heat Islands, and Health Outcomes in Greater Cincinnati. The 1 hour webinar hopes to explore the connections between climate change, urban heat islands, and health outcomes in Greater Cincinnati. Our panelists are going to make brief presentation followed by Q&A. Then we will wrap up with the next steps and some announcement. With the recent change in Green Umbrella identity from Regional Sustainability Alliance to Regional Climate Collaborative, we joined more than 30 other collaborators across the country, all of working in cross-sectional jurisdiction around climate action. And given our staff and existing programs and our partnership we have been established over the past 25 years, Green Umbrella is now actually the largest regional climate collaborative in the country. This effort, is being it's being conducted by 3 primary staff members here at Green Umbrella. Myself, Nobi Kennedy, who is the Regional Climate Collaborative Coordinator, and also Savannah Sullivan, who is the Senior Director of Programs and Climate Strategy at the 3 primary staff supporting the climate health equity work. Alongside with us is our Climate Health Fellows, who is Mitch Singstall, the 4th-year student at the University of Cincinnati Medical School, and Leah Rose, who is also an undergraduate medical student at the University of Cincinnati. The Climate Health Equity Webinar series built on the recently completed report done in partnership with Scioto Analysis to highlighting the findings of this report and accelerating actions on key related issues. We have released a public service announcement toolkit connected with the topics covered in this webinar series. Please visit our website and other media platform to read the report in full and also make some contribution. The PSA will cover 11 climate health topics, 1 per month, and we provide a data and also shareable media materials every month. Additionally, the campaign will share actionable strategy at the individual and also system level. This month, public service announcement campaign covers climate change, heat islands, and health outcomes in Greater Cincinnati. Do you know that climate change is contributing to the increase in heat islands in urban areas, and most of the urban areas experience significant higher temperature than their rural surroundings? And also, do you know that these heat islands have serious implications for public health? Heat stress is one of the leading causes of weather-related disease deaths across the globe. Vulnerable populations such as elderly ones, young children, individuals with pre-existing health conditions face the most brunt of this impact of these heat waves. And as a matter of fact, do you know that due to the unique features of the region, changing climate, Greater Cincinnati is vulnerable to heat islands, which impact the health outcomes in the region. Then what can you do? What can I do? What can institutions do? At this junction, I would like to introduce our panelist who is going to dissect this topic and also be ready to provide an answers to a few questions that we are having. Our panelist for this month is Dr. Vivek Shanda. Vivek is a researcher, an entrepreneur. Over the past 20 years, he has been providing guidance to diverse organizations for managing urban landscapes for public health, including also in his research area is social justice, economic prosperity. He has published over 100 scientific journal articles, 5 books, and serves on several federal, local advisory boards. He served as a professor of geography at Portland State University and is a founder and currently advisor to Kappa Strategies, a global consulting firm that supports community adaptation to a warming planet. During his spare time, he reveres in the mountains and waters in the Pacific Northwest and pines for wood fire, pizza, and picnic table. Please join me as I welcome Dr. Vivek Shanda for his presentation.
Hello, everybody. Thank you for that introduction, Bamidele. I'm also grateful to Nobi and Savannah and the whole Green Umbrella team for the opportunity to present some of the work we've been spending some time trying to understand in terms of climate change and health risks more generally, though this presentation, I've just got 2 examples that I want to share with you that we've been working on for some time. And maybe what we can do is have a discussion afterwards about what ways this work is relevant to previous work that's been done already in the Cincinnati metro area, and we can get into conversations about your own interest in this topic of climate and health and how folks like Green Umbrella can help support the work that's happening regionally. I will say I'm not in Cincinnati. I've been to Cincinnati many times. I work with people who did their both undergraduate and graduate school in Cincinnati and have spent time in the art museum as well as several other places in town, and it's a lovely place to be. I'm a big fan, and I though I don't have any depth of knowledge that many of you who have lived experiences in Cincinnati might bring to our conversation. So my interest really is in learning from you about the kinds of ways in which some of the broader topics that I bring up today focused on heat action planning, urban inequities, and trying to understand the health risks that are associated to various different warming conditions that we're seeing happen across the world and translated into local communities like Cincinnati. Next slide, please. And this is a set, just to introduce myself a little bit, I grew up about 8 degrees. If you go back for a second, just so we can look at the photos a little bit, but maybe I'll just go through it. That's fine. I grew up, just these 3 slides, I grew up in South India, where I was essentially exposed to about 8 degrees above the equator, where there's a lot of heat constantly. And so my personal experience with heat is something that really drives much of my professional curiosities as well, because when I moved from South India and my parents took me from my friends and family and dropped me into the United States at the young age of 10, I quickly realized that temperatures were not the same around the world, and that my sweltering hot, sweaty March and April months, which were the hottest months in South India, were very different, and that the humidity wasn't quite as strong when I was on the west coast of the United States. I grew up mostly on the west coast of the United States after age 10, going from California to Washington State, Oregon. I spent some time in New York, and quickly realized that there is a need to understand the differences in the way that people experience heat. And when we just to fast forward after a fair bit of professional training in various parts of the country, I landed in Portland, Oregon, where I am now. And back about almost 15 years ago now, I wrote a paper that is here on this slide called Climate Justice Towards a Proactive Response to Social Inequities. And 15 years ago, when I published this paper, folks looked at me very confused and said, "What is climate justice? Why is that a term that you think is important to bring up?" There were people writing about climate justice, but it was a very niche area. And especially bringing climate and social inequity together, there was no such thing that was really being deeply discussed. It was in the academic and university settings that these topics were being brought up. And nevertheless, I wanted to publish this just to show a real world example of how distribution of climate warming gases as well as temperatures were concentrated in areas that were often consisting of folks who were historically marginalized and neighborhoods that were historically disinvested in across the city. And I started thinking immediately that this is not a phenomenon that was unique to just the city I was living in, Portland, but something that might be more relevant across the country, though I had very little empirical evidence to point to around the relationship between social inequities and climate change. In universities and many other places where I have seen climate work happen, it's often done in a very scientific, removed of the social dimensions of climate. And that continues to this day. And it's something that I've been consistently trying to change in the university setting, because the students that come into the university are often asking for more intersectional, integrative, interdisciplinary approaches, which universities often struggle with. And so I've often been kind of on the sidelines of many disciplines, trying to sing the song about the importance of bringing these together, because in the world of practice, which I imagine many of you are directly involved with, those disciplinary boundaries quickly break down, right? And we need to start thinking about what is the problem at hand and how do those problems bring together the myriad different disciplines that are necessary for us to be able to solve this challenge. Living in Portland in 2021, I witnessed something that I had seen in other parts of the world, but never actually lived through in quite a severe way, where the image on the left is a image of a big heat wave that came through the Pacific Northwest in late June of 2021, and it killed over 1,000 people in a couple of weeks, and was one of those wake-up calls, because the paper I'd written and the multiple papers I'd written leading up to 2021, most of the practitioners in the region said, and I quote, "That's really good. That's really cute work." And it was a moment for me to recognize that people in the region, especially in the northern parts of the country, which I would also put Cincinnati in the not quite. It's southern. It's towards the central of the country, but still there's a lot of preparedness planning that Arizona, Texas, Florida, South Carolina, etc., have done that Cincinnati or Portland or Seattle or Minnesota or Minneapolis haven't done yet. And so when this heat wave came through, it killed many people very quickly, similar to the 1995 heat wave in Chicago. And we wrote a paper, which is this other image on the right of the screen, looking at what were the implications of that heat wave. And I compared it to the 2009 paper because it really showed that just across a 15-year period, the sensitivity to this phenomenon of heat has changed, I would say, almost from night to day. It has become very, very apparent that heat is something that is the direct way that people experience climate change every year, and that while floods are increasing in frequency and intensity, hurricanes are doing the same. We're seeing that heat is a much more lived experience and a much more lethal killer than any of the other natural hazards on an annual basis. And so that's where this work really roots itself, and where my background at least kind of brings to the front. If you go to the next slide. And I have some animations here, so bear with me. This is a slide that I use to just illustrate how we go about doing this work. I advise for an organization called CAPA, which stands for Climate Adaptation Planning and Analytics. And it really is an attempt to kind of get the work that's happening in universities and other places that tend to be very forward thinking and trying to be anticipatory, trying to be of service to broader society and to the inequities that I mentioned already, and trying to bring that into action. Like, what are the ways in which this work can actually translate into practice? And so the way we approach this is we first try to characterize risk by looking at the context of a place like Cincinnati, identifying the stakeholders that are involved, developing heat maps, physical heat maps, which leads to a hazard assessment of a region. That helps us with engaging communities in that process. If you go back, yeah, and leading to specific interventions and guidance that allow people to be safeguarded. And those are the actions. The implementation of specific interventions is really the actions. And we spend a lot of time in this work on 4 different domains, partly because they're very well connected. One is the natural and built environment. That's kind of thinking about green spaces, thinking about buildings, examples that I'll mention in a second. Those are directly connected to various exposure pathways. So whether through work or through your residential exposure, and that links to your ability to be healthy and well during an extreme event, which then leads to your ability to cope to some of these extreme events like heat or flooding. And that, of course, needs to be connected to a set of actions to be able to reduce that potential exposure and health impact. So if you go to the next slide, to try to bring these 4 concepts together, I've kind of put together this animation to bring together those 4 concepts. So if you take the natural and built environment, there's land use history, there's building codes, energy grid, that all drive potential exposure. And people are exposed in a variety of different ways to extreme heat, partly because they're working outside or they don't have air conditioning or, because the building codes don't allow it. There are specific regulations that are in place. There are people in school and other places that are consistently exposed because the buildings may not have adequate insulation or cooling options. Those drive effects that essentially create a level of affect mental and emotional health. Healthcare and healthcare status is also affected by citizenship in the United States. It's affected by access to healthcare, as we know, the ability for emergency response to arrive to your house or place relatively quickly. And then that capacity for being able to access and have healthcare available is a capacity that really leads to our well-being and our ability to connect with others to create social cohesion. And this is a graphic I use and developed because, in part, what we're trying to do is identify what are the places in this kind of mix of different components where we can be of service. And if you just click on the forward button once, we will, I'll at least illustrate that in the middle of all of this is a heat risk assessment where we're trying to monitor where in these areas do we actually see the vulnerability. We talk about heat vulnerability a lot. Nevertheless, there are many places where vulnerability can actually show up. It could be just in the it could be just because of the land use history of the place you're living. It could be because there are certain labor laws that aren't in place in your community. It could be because somebody's living in a place where there is very little access to health care. Or it could be because there's a perception of crime in a neighborhood that keeps people from leaving their house and therefore staying in a home that's going up to 100, 120 degrees Fahrenheit. And so that can happen in a variety of different contexts. And this graphic is mainly to illustrate that there's a very interconnected relationship across the multiple domains in a place like Cincinnati. And I want to kind of make this case in the next slide over the future of where we're seeing this work happen. If you go to the next slide. This is work that we're doing, that we're just publishing now, looking at the future of heat and health. And I want to just break this down for you in two different graphs. This is a paper that will be coming out in the coming months, where on the left side, we are looking at high emissions scenario for carbon and other greenhouse gases, where we're anticipating a shift in the amount of heat-related illness, where we use a modeling, a systems dynamic modeling platform to project and predict out to 2040 what different regions of the country will face in terms of heat-related illness. How many people, in other words, will be impacted by heat-related illness in these areas around the country. What we see here immediately is that the West Coast, at least on the graph on the left, the West Coast will see a shift from about 250,000 people on the West Coast being impacted by heat in 2005 to over 2 million people affected in 2040. So we're seeing, multiple orders of magnitude shift. Almost 8 times the number of people will be affected by heat in the coming decades. And that's significant for us when we start talking about what it means to be living in a place that is extremely hot. This graph on the right illustrates per heat event. So we're able to actually look at individual heat events and see how many people are impacted by that. The 2021 heat event that happened in the Pacific Northwest killed over 1,000 people. And what we wanted to do is look to see if the regions are equally affected. So what the graph on the right represents is how prepared are regions to the extreme heat. And you'll see that Ohio Valley, where many of you might be currently living, doesn't show up as, it's the red line on the bottom on the left graph. It doesn't show up as increasing quite as much as the West or the Southeast or the Southwest, as we see in the South or the Southwest in the left graph. Ohio Valley shows up as the third highest in terms of per event of heat-related illness. And so what we're seeing is that the graph on the right really suggests that there are some places that are far less prepared for extreme heat as other places. And so what we're getting at with this paper is that there is a real need to start taking precautionary measures. And that's what I want to spend the rest of the time I have talking about. And so if you go to the next slide. One of the ways that we do this work is trying to understand individual exposure to heat. We can do regional assessments, and we worked with groups like Groundwork, Ohio River Valley, and the city of Cincinnati to conduct various campaigns on heat at the regional scale. Where our work is going is trying to get down to the individual scale of what is it that an individual or a neighborhood would experience in terms of heat, and how is it that we can better equip that neighborhood to be far more responsive to these extreme climate events. So if you go to the next slide, going from the city to the individual is no small endeavor. And so what we do is we enlist communities in this work. This was an example that we worked on with folks like Savannah Sullivan, who used to work at the city of Cincinnati and part of the Green Umbrella group, to conduct a heat campaign where we instrument cars with a set of sensors, go out and collect temperatures in the morning, which is the map in the top, afternoon map in the middle, and evening map in the bottom, and look at what the temperatures are using, in this case, over 80,000 temperature measurements over the course of a day. And that helps us better understand who's getting exposed to the higher levels of heat. As you can see, the heat in the morning is largely in the southern part of the Cincinnati area. And then while in the afternoon and evening, that heat shifts, the heat islands and the kind of exposure dynamics shift to the center and the north parts of the city. And that to me is a very interesting phenomenon, because this isn't a static event. It actually affects different parts of the region pretty consistently. Whereas the west part of the city, the bluer colors, the lighter blue, if you look at the maps, remained pretty cool the entire time throughout the day. So there are some communities in Cincinnati that are experiencing a 90-degree day as 85 degrees, and others that are experiencing it as a 95-degree day, or even a 96-degree day. And as temperatures go up, so as temperatures get up to 100 or 105, that difference of temperature increases from one part of the city to another. So that's really what we're talking about when we engage communities, is to have a conversation about what does it mean to live in a place that you measured to be 10, 11, 15, 20 degrees hotter than another part at the same time. And this was done 4 years ago, but nevertheless, I suspect that many of these patterns are probably still consistent today. If you go to the next slide. This was a project, and the only one other project I want to bring up in this short time I have is a project that we explored, looking at the relationship between public housing and not outdoor, but indoor exposure to temperatures. And we looked at 3 different types of housing structure in Multnomah County, Oregon, which is a part of the country I currently live. And we want to do this in other parts of the country as well. This is a really interesting project to, if you go to the next slide, to work with residents in these buildings to understand the place, to record temperatures, to conduct surveys with residents, to conduct workshops with residents, and then to share the results with the residents and participants so that we can identify potential solutions and co-develop those solutions with the communities living in these places. And so we wanted to really know what are the common coping strategies and what are effective interventions. Next slide. The project really was setting up these little sensors inside homes, and it was really amazing to work with a community to be able to set up a sensor that describes temperatures, tells the resident if temperatures are going above 80, above 85, above 90 on a day, so that they can take action. The graph essentially shows across the 3 buildings how, as the dotted line, as outdoor temperature goes up and down throughout the day, the indoor temperature rises and is usually highest during the evening time and gets above 80 and stays above 85 on average for 2 of the buildings and above 80 for 1 of the buildings, pretty much throughout the day, and then especially into the evening. These are averages. There were some residences that we measured upwards of 95 degrees for prolonged periods of time that people were living indoors. Again, public housing that some of them had AC, some of them didn't have AC, and yet temperatures were still relatively high. And above 85 may not seem hot, but for a person living in a space that's above 85 for a prolonged period of time, it can be a very severe health impact that occurs. If you go to the next slide. We were able to monitor, then we were able to conduct individual cooling strategy questions. People largely use fans to cool. There's places, about 35 of the 55 respondents use air conditioning as well. Others are very much limiting cooking inside, as well as closing windows during the daytime, opening them up at night. Those kinds of very localized strategies were used. The survey was getting us to. If you go to the next slide. We also were able to get at various ways in which the community members, through workshops, identified possibilities for recommending cooling options. So things like thermal curtains to block out the sunlight, very simple little things, window films, whereas maintenance and weatherization and insulation were larger things that the building owner was primarily responsible for. There's cooling centers that we really that the community identified as really helpful. Resources and communication to make sure people are aware that it's going to be a heat wave coming through. And then finally, community building activities such as kind of meetups and small block parties so that people can get to know each other, so that during an extreme event, they can stay connected and potentially more resilient during those particular extreme events that come through. And these set of recommendations were co-developed with the community and really lent itself to a very localized and tailored approach for individual building residents. The city, it turns out, and I'll put in the chat, I'll put the full report I'll put the full report in the chat so that you can actually go to it and find what it is that was done, how it was done, and other related efforts. Let me see if I can pull this up here, or I'll put it in after I present. It's too hard to present and do this at the same time, so I'll do this after I present. But the full report, I'll put the link in the chat for you to follow up just as I close up here. And so if you go to the next slide, where I want to end today with is at least describing kind of key takeaways between heat and public health. The approach that we take of connecting these different aspects is really about grounding any effort that you do, as I imagine many of you do already, in the principle that all individuals have the right to be protected from climate-induced events. So just trying to identify which communities are experiencing the most acute harms is one of the first questions we ask, and that's where a lot of these assessments and monitoring of heat risk contribute to that first question. A second piece that takes a bit more deep investigation is identifying what or who is amplifying the spatial injustices or the climate-induced injustices from the built environment. We know that all neighborhoods aren't built the same. Some were disinvested in for generations. Others have been invested in. Communities have been marginalized, not brought to the table for conversations about what happens to those neighborhoods. And so identifying what or who's amplifying the harm is really at an essential deeper question that we ask. And then finally, I think the work that many of you might be already involved with is this public health model of prevention. And the question that we ask here is, what can be done to revise our built environment to reduce the effects of extreme heat to the public's health? Like, can you think about greening? Can you think about engagement? Can you think about ways in which different strategies that might work well for your own community would be most effective? Because temperatures are continuing to rise. We'll see another hot summer. We'll see those occur in ways that we might not even expect, and all of a sudden we've seen flash floods on the rise. We've seen extreme heat emerge very quickly, and so these things are happening at a bit more rapid scale. And so thinking about what can be done in the built environment is an immediate lever that can at least turn down temperatures many degrees so that people might not be exposed to quite as high temperatures even when a heat wave comes through. So with that, let me close out and just leave some contact info if you want to follow up with any questions or continue the conversation. Thanks for the time again. I really look forward to seeing if any of this resonates with work that you're doing in Cincinnati, and if there are things where we could potentially explore further collaborations as well. So with
Thank
that,
you for the presentation, Dr. Vivek. Really appreciate you. Thank you. Very informative. So this point we want to ask, we have a few questions, and we want to let the audience know that you can drop your question, or you just jump up of, just unmute yourself, and you can contribute. So I want to start with this question that what made the region, Greater Cincinnati, susceptible to heat-related illnesses?
yeah, this is a question that comes up for every region that we've worked in. Is what are the potential climate implications? And the only way to really get at that we know of is to use what are called downscaled climate models. And the challenging part with downscaled climate models to identify potential risks is that they're very, very deep science work. Yet it's the only way we can kind of come up with a means for understanding, what are the longer term projections. There's a few tools that have been set up by the National Oceanic and Atmospheric Administration. For example, the Climate Explorer is a tool that I would point you to kind of look at the future of a region, and it is enough to kind of generalize. It doesn't get into a lot of the kind of neighborhood, or even in some ways the I'll put the link here, or even some ways that the tax lot or parcel that folks are in. But nevertheless, it can get you an understanding of out to 2040, 2060, 2090. What are the changes that the region would experience in terms of precipitation, in terms of heat, in terms of, in your case, you won't experience a sea level rise, so there is a sea level rise module. But there are ways to think about this. Another tool that National Oceanic Atmospheric Administration just put out that I'm watching is also called CAMRA. It stands for something like Climate Risk Assessment and Modeling Analysis, something like that. And I can put that link too, but it's another tool that is available for you to look at for understanding what local climate impacts are. And it's great to have these. They tend to be a little bit more coarse scale than what we tend to work in. We tend to work in much more kind of neighborhood and individual tax lot type of parcels, because each of those are going to vary. But this is a big question right now. And the challenge is that many consulting companies will come up and say, we have the secret sauce for telling you exactly what the climate risk is. And I'm still in disbelief about anybody who will come to you and tell you that. We can start a conversation about how to prepare for some of the anticipated climate risks, but actually telling you what the risk is, as you'll see on things like Realtor.com or Redfin, or these real estate companies that are putting individual climate risks for every parcel. I would take that with a grain of salt. Those are very, in my estimation, very coarse and poor assessments of climate risk, and they tend to average out. They tend to average out larger trends and are pretty early in their development. So to really think about that just very lightly and not take it too seriously at this stage, as the entire field of climate risk continues to try to get its feet under itself.
Thank you for the answer. So the second question there is, how can heat-related illnesses impact the health outcomes of the region?
How can heat-related illness, can you ask again?
Yeah, how can heat-related illnesses impact the region? There are these due to the urban heat island, so there are illnesses that comes with it. So how can this really affect the whole region as a whole?
Yeah, that was my that was the fifth slide that I had in my presentation, really looking at how heat-related illness in the Ohio Valley, the model shows compared to other regions of the country that per event is going to be driving a much higher proportion of heat-related illnesses than kind of looking at heat-related illnesses across the country as a whole. So each event, I think, will be more expensive and more impactful in the Ohio River Valley than kind of taking in all the year's events. So think about like an early June event that might occur in the region. People are coming out of spring. It's not quite as warm yet. There's not an acclimatization that's occurred. And so people are still not quite ready for the extreme event. So that's what happened in the Pacific Northwest in 21. And it was a wake-up call because it really killed a lot more people than a heat wave that might have happened, let's say, in September. So the timing of heat is really important, as is, of course, the preparation for it. And that takes on a whole different set of kind of systemic approaches as well as kind of community engaged approaches that are necessary.
Thank you, Dr. Vivek. So I think so we just have one more question. So before we wrap up and move to the next slide. I just want to ask that what can institutions do? I know you talked about how individual can really become more resilient to these heat-related illnesses. So I just wanted to kind of maybe more light on how institutions can really be what are those things they can do to be more resilient to the impact of these heat-related illnesses.
Yeah, I think yeah, that's kind of where most of this talk has been heading. It's kind of individuals by themselves are the most vulnerable when they're not connected to others. That's a very basic thing. If I had a magic wand and I could say, if there are two things that I would do to ensure the entire region is more safe, one is I would invest in things like resilience hubs. It's a very popular topic right now across the country, and I'm trying to get the federal government in the advising I do to move towards funding a lot more of these resilience hubs across the country. These are community driven. These are community driven and organized spaces that provide provide respite and kind of an oasis of sorts for that's safe and secure and culturally responsive, and allows for communities to show up and actually spend time there during extreme events, as well as be places of information sharing, community building, a variety of other strategies that can be used there. It seems to be getting traction. I'm seeing a lot more RFPs that local cities and regions are putting out for resilience hubs. That would be the first thing. The second would be to do a lot more kind of block parties. The most inexpensive thing you can do is get to know your neighbors, and place is really important in this work. I continue to see the importance of place, and not just places in the Ohio River Valley, but place as in like your block, and if you're in a rural area, your immediate neighbors around you. And even if you have to go some distance, getting familiar with the people around you is one we've seen the most important things you can do. Of course, staying hydrated and all the things that are pretty conventional that you will hear CDC and other groups provide. I mean, of course, that stuff is a given in my mind. But the bigger lift is really around kind of creating safe spaces for finding refuge during extreme events and community building through block parties and the like.
Thank you for providing answers to that. So really appreciate those information and the sharing of those links too. So next steps is to adopt climate resilient strategies. So what individual can do is to stay hydrated, as Dr. Vivek has said. So limit outdoor activities, rest often, especially when you walk outside during this sunny weather. Check on vulnerable individuals in your neighborhood, just like the block party that I talked about, and you support weatherization. So what can institutions do is really to invest more in green infrastructure and initiatives, and plant more trees to reduce heat illness effects, and also use cleaner energy in high energy use buildings. Step up policies, efforts to create comprehensive plan on tree and landscape ordinances. So we have more of this, and we can also send in a follow-up email to every audience, attendees today. So we have a couple of announcements to make. So by later today, by 5 to 7, we have green drink. So you please endeavor to participate in that. So you can check our website and see the other information. So we have also have by July 10, we have it's going to be our next climate health equity webinar. So it's going to be climate change, extreme weather events, and health outcomes. So it's going to be between the same time, so 12 noon to 1. So by June 11th, so we're going to be having green drink also at Samuel Adams Cincinnati tap room. So it's between 5 and 7 p.m. So by July 12th, it's going to be July 12th, which is next month. So it's a Green Space Alliance program, which is Meet a Green Space Hiking Series. So the first series was done this last month and this month. So another series continue next month is going to be July 12th. So at the Laking River Greenway. So between 3 to 4:30 p.m. So also we want to enjoy you that you visit our website and at greenumbrella.org, and to get more engaged on our programming. And thank you, thank you for joining us today. And we hope that next month you're going to join us on another exciting topic. So thank you, and have a great day.